Question. A 55-year-old male with a history of heavy alcohol use presents with confusion, gait ataxia, and nystagmus. On examination, he has bilateral horizontal nystagmus and dysmetria on finger-to-nose testing. Laboratory tests reveal an elevated blood alcohol level, but it is not significantly higher than what would be expected based on his reported alcohol intake. What is the most likely diagnosis? A. Acute alcohol intoxication. B. Wernicke-Korsakoff syndrome. C. Benign paroxysmal positional vertigo, BPPV. D. Alcohol withdrawal syndrome. The most likely diagnosis for this patient is B. Wernicke-Korsakoff syndrome. This patient's clinical presentation and history of heavy alcohol use are highly suggestive of Wernicke-Korsakoff syndrome, a neurological disorder often associated with chronic alcohol abuse. Here's the rationale for choosing this diagnosis. Clinical presentation: the patient presents with confusion, gait ataxia, unsteady and uncoordinated walking, and nystagmus, involuntary, rhythmic eye movements. These neurological symptoms are characteristic of Wernicke-Korsakoff syndrome. History of alcohol abuse: the patient has a history of heavy alcohol use. Chronic alcohol abuse is a major risk factor for the development of Wernicke-Korsakoff syndrome. The syndrome is specifically linked to thiamine, vitamin B1, deficiency, which often occurs in individuals who consume excessive alcohol. Nystagmus and ataxia, bilateral horizontal nystagmus and dysmetria, lack of coordination, on finger-to-nose testing are neurological signs consistent with the syndrome. Nystagmus is a well-known feature of Wernicke's encephalopathy, the acute phase of the syndrome. Blood alcohol level: while the patient's blood alcohol level is elevated, it is not significantly higher than what would be expected based on his reported alcohol intake. This finding suggests that the patient's current neurological symptoms are not solely due to acute alcohol intoxication. Instead, they are indicative of a chronic neurological disorder associated with long-term alcohol use. Now, let's consider the other options. Acute alcohol intoxication, option A: while the patient's elevated blood alcohol level indicates recent alcohol consumption, the chronic nature of his symptoms and neurological findings, nystagmus, ataxia, are not consistent with acute intoxication. Additionally, the blood alcohol level is not significantly higher than expected for the reported alcohol intake. Benign paroxysmal positional vertigo, BPPV, option C: BPPV typically presents with brief episodes of vertigo triggered by specific head movements, often when changing positions. It is unlikely to cause the chronic, persistent neurological symptoms and signs seen in this patient. Alcohol withdrawal syndrome, option D: alcohol withdrawal syndrome can present with confusion and neurological symptoms, but it is typically associated with a constellation of symptoms that include tremors, seizures, anxiety, and autonomic hyperactivity. The patient's current presentation is not characteristic of alcohol withdrawal. In summary, given the patient's history of heavy alcohol use, neurological symptoms, nystagmus, ataxia, and the absence of significantly elevated blood alcohol levels, the most likely diagnosis is Wernicke-Korsakoff syndrome, a serious neurological complication of chronic alcohol abuse.